Hi guys, once again it's Benny and Richie.
Hi.
Yeah, this is another exciting episode we are bringing your way.
Yeah.
All right, so today we'd like to react to some medical memes we've come across with you guys.
Yeah.
Yes.
Medical memes, interesting ones,
Yes,
funny ones,
yes.
and all the vibe. Good. So what do we have? Let's see.
So first of all, what I have here is Doc, it hurts when I touch my shoulder.
Yeah.
That is a patient talking to a doctor. And the doctor says, don't touch it. The
Right.
doctor charged $60. Yes.
Yeah. Some people don't understand why they have to pay for consultation only to come and receive something they already
Don't
knew
do
of.
it.
Like, don't do it. And they're like,
And you know, it's
Exactly.
interesting when someone comes to your consultation and all the complaint they have is, I feel pain when I sit on my butt, for example.
okay.
Then don't sit on your butt.
Really? Is that why they are paying so much?
I came across a funny video,
Right.
and all the people were trying to put across what?
Right.
That is all the doctors do. Oh, doctor, I feel pain when I do this. Don't do it.
Don't do it.
Next. Doctor, I feel pain when I do that. Don't do it. Next.
Right.
So yeah, making it look like that is all we do, but that is not all we do. We give the pain medications when we have to, and then we give the counseling when we have to.
Yeah,
At
sometimes
times
if we
it's-
have to investigate
Yes.
the underlying condition, we'll do that.
We'll do that.
Okay, so the doctor summarizing everything doesn't necessarily mean he's taking it like for granted.
And yeah, definitely we charge for consultation. So if I'm just saying don't do it, I will have to charge for the consultation fee.
Next meme. So there's a convo between me and the therapist.
Okay.
Right. So me, I'm terrified of random letters. Therapist, you are. Me, screams. You are. Therapist, oh, I see. Me, screaming intensifies. So the therapist is mentioning random letters. Oh, you
Oh,
are.
okay.
Oh, I see. And it's worsening the patient's condition.
I get it now.
I didn't got it right.
No, I read it, but I skipped it because I wasn't getting. I get it now.
I think we should put this there with this reaction. And then I get this now. We should. I'll watch it.
In order to follow, that is from the nurse to the
Right.
patients
Right.
in the waiting room. In order to follow privacy requirements, we can't call our patient by their name. The lady with hemorrhoids,
This is unethical.
very,
This is
very,
unethical.
yeah.
But you know, sometimes it happens in a clinical setting. Bed 1, refer to patients as bed 1, bed 2. This is not right. Okay, the case with the
Yeah.
stroke, the case
Case
with
one,
that, you
case
know.
two, yes.
Yeah,
yes.
it's best to use the names. Yeah, I think that's the appropriate
yes.
thing to do. Use their names right.
It shows that we have the soft spots. Like we are not just robots as
Okay.
health workers.
Okay.
We relate with human beings
Yeah.
as well. Yes, we have emotions.
Yeah, we are not just
working.
managing the cases.
Yes,
The cases
yes.
with the patient.
Exactly.
So the patient's ID should be considered.
So the lady said, the one with hemorrhoids coming. So
Next meme.
all right.
So there's a conversation between the doctor and me. Doctor, I've got some bad news. Me, lay it on me gently. Doctor, okay. Knock, knock. Me, who is there? Doctor, herpes.
Help is who? All right, so the next one I have here. So a patient says, well, yeah, see, doc, the problem is obesity runs in my family. And the doctor said,
I've heard this one.
no, the problem is nobody
No
runs,
one runs in your family. Wow.
Yes.
That's a low-key job.
Actually, yeah, it is.
We don't do that. We don't do that. We don't do that. But you should run if you want to lose weight.
But actually, it's also a nice way to let the patient know that you have to lose weight. Though it's a job, you have to lose the weight. I have one here.
Yeah.
So it's a picture showing something. I'll say it at the end of the what is written.
Okay.
So when a patient doesn't want to cooperate with any of the medications and treatments,
Yeah.
they are showing a coffin. Yeah, that means you want to.
This is what you want.
Yes,
This is what you want, right? Yeah.
So guys,
It's like
when we are counseling you guys on the need to take medications,
Right.
it's not like we are forcing it on you. It's for your own good.
Yeah.
So at the end of the day, if you don't take these medications and the condition gets out of hand, the coffin is what we show you.
We don't do that. But that's the implication. You take your medications if it's hypertension and all that. Because sometimes we use that indirectly. We let you know that not taking your medication means stroke.
Yes.
It means a heart attack and all. Yeah. To kind of, some people need that scare and then they go ahead to.
They actually do need a scare to take the medications.
As usual, convo between doctor and nurse, right? So the doctor says, nurse, how is that little girl doing who swallowed 10 quarters last night? Nurse, no change yet.
Oh. I get it.
You get it, right? If you get it, let us know in the comment section. Short conversation between a patient and doctor. Patient says, doctor, I get heartburns every time I eat birthday cake. Doctor says, next time, take the candles off. Why did the doctor laugh at the x-ray? Because it was humorous.
So for those of you that don't get it, humorous is a bone in the body. And also humorous, it sounds like yes.
I played hide and seek in the hospital, but they kept finding me in the ICU.
I see you.
What's the ICU anyway?
ICU is the intensive care unit.
Right. Yes. What happens in the ICU?
So we take care of critically ill patients. So people that actually need ventilators. Those that need
life support and all
like
that.
close marking in terms of care.
Right.
Yeah. I have one here. Showing a picture of medical students taking a selfie during their graduation.
Okay.
And they are all old women.
Finally.
Yes.
It takes a lot of time.
It takes a
chunk of your youth, right?
Yes.
Invested in studying medicine and finally becoming a doctor.
Yes.
Becoming a specialist. And then further on,
so
right?
There's this thing I came across. Posted by someone on social media. That medical school takes a chunk of your youthful days and years. And also during your internship. In our setting, which we call house job, it also takes another chunk,
right?
And finally, when you become a doctor, a medical doctor, and you get to the point where you have to charge for the skills you've acquired and the knowledge you've acquired, people would think you are overcharging or you're doing too much.
Right.
But when you hit pension, and you don't even have a house or a car to show for, they come back to say the doctor is poor. So what can we do as health professionals in such cases?
Like in relation to what you're saying, we do realize that worldwide, globally, doctors are underpaid. Sometimes they go on strikes and all that, requesting for increase in salaries and better working conditions and all that. Because it's one of the professions, like we said, involves a lot of sacrifice. And then we say that doctors should be, it's a calling, should be compassionate. Why are they always calling for better monetary terms and conditions? But it's needed.
We need it. We need the money.
It pays. Medical school is so expensive.
Very.
If you have to go online and, find out the cost of medical school and all that, you'll be blown. And in the US, you have doctors who, they have to take loans and all that. They have to go to medical school.
And at the end of the day, they will pay for the loans.
So it just makes sense. It only makes sense to, the health is so
will
important.
charge for the knowledge and the skills he or she has acquired.
Doctors will be paid well, right?
Yeah, definitely.
So I've got a disease where I can't stop telling airport jokes. The doctor says it's terminal. I hope you get it.
Okay, so let me just read it.
Okay.
So the doctor, after I told about my past medical history, how are they still alive? Some patients have a whole lot going on, and you wonder
5 previous cesarean sections, 6
one previous myomectomy in addition to this, maybe 5 previous cesarean sections and a previous salpingectomy on account of the ectopic pregnancy, and you are wondering how they've still come back.
Massive P, and they survived. Right?
Yes.
Miracles do happen.
Yes.
So a conversation again between a doctor and a patient. Doctor, I have some bad news and some very bad news.
Okay.
The patient, might as well give me the bad news first. Doctor says the lab called with your test results. They said you have 24 hours to live. Patient, 24 hours? That's terrible. What could be worse? What's the very bad news? Doctor says, I've been trying to reach you since yesterday.
So
it means he has less
the
than
time is
2
up.
hours.
Oh wow, that's sad. I think I came across another one that is similar. It says, so the doctor was showing a medication to the patient, saying that you will take this pills then your entire life,
right?
And the container just had 3 pills.
And the patient asks, it has just 3 pills. Yes. What does it mean? Doctor says, exactly.
After the 3rd one, that's the end of your life.
No, we don't jokingly have to break such bad news. We don't do that. Anyway, but these are jokes, you know, memes. What's the difference between a general practitioner and a specialist? One treats what you have. The other thinks you have what he treats.
Well, yes.
Why? Which one has the? I'm wondering which is which.
Oh, I responded before thinking. So I was like, what did I respond to? What does it mean? All right, guys. So these are the few of the memes we brought your way. There are many more we'll bring in the subsequent episodes. Make sure you leave comments in the comment section, as well as share and then like our videos for us. And also, if you have some, share with us.
Yeah, laughter is good medicine. So
exactly.
Catch you guys on the next episode.